Today, we are diving into a condition that so many of us have heard of and a whole lot of us have probably felt: carpal tunnel syndrome. We're going to break down what it is, what's really going on, and what you can do about it, all in the next few minutes.
So let's start with a feeling I bet is all too familiar for some of you. You're just waking up and bam, there it is. That weird, tingling, pins and needles sensation in your hand. It's that uncomfortable, almost buzzy feeling that can literally jolt you awake.
And what's the very first thing you do? You shake your hand out, right? Or maybe you do that thing where you just let your hand dangle off the side of the bed, hoping gravity will sort it out. Well, if you thought that was just some weird quirk of yours, trust me, it's not. It's an incredibly common, almost instinctual response.
So let's put an official name to that experience. We're talking about that classic pins and needles feeling. It's the first major clue our body sends us.
If you've been nodding your head this whole time thinking, yep, that's me, then what you're feeling isn't just some random, bizarre thing your body does. It is the textbook classic sign of carpal tunnel syndrome. It's a very clear signal that something specific is happening inside your wrist.
So what is actually happening to cause that sensation? To really get it, we need to take a little trip inside the wrist.
Okay, so here's the deal. Your wrist has this narrow little passageway, think of it like a tunnel, called the carpal tunnel. And through that tunnel runs a super important nerve called the median nerve. This nerve is what gives you feeling in your thumb and first three fingers. Carpal tunnel syndrome is simply what happens when that nerve gets pinched or squeezed in that tight space.
You know, the best way to think about it is like a highway. The median nerve is a highway for signals between your brain and your hand. When the tunnel gets crowded and narrows, it creates a massive traffic jam. The signals can't get through properly, and that backup is what you feel as tingling, numbness, and sometimes even pain.
Which, of course, leads to the next big question: why does this nerve traffic jam happen in the first place? Let's get into who's most at risk and what kinds of things can cause that pressure to build up.
Now, this is really interesting. While literally anyone can get carpal tunnel, the data shows it's diagnosed most often in one specific group: middle-aged women. We're not 100% sure why, but things like hormonal changes are thought to play a part.
And here's something that can be a little frustrating. For a lot of people, you can't point to one single thing that caused it. There is no big injury, no one event. In medicine, they call this idiopathic, which is really just a fancy way of saying the exact cause is a mystery.
But even if it's often a mystery, we do know about a bunch of risk factors, things that can make that tunnel a lot more crowded. We're talking about conditions that cause swelling or inflammation. For example, the fluid retention that happens during pregnancy can put extra pressure in there. Or something like arthritis can literally change the shape of the bones, narrowing the space for the nerve.
Okay, so we get the what and the why, but let's talk about the what now. Because the really good news here is that there's a very clear, well-established path for finding relief and getting things back to normal.
Doctors almost always follow a logical two-step approach. And no, they don't just jump straight to surgery. Step one is what we call conservative care. This is all about reducing that pressure without an operation. So things like resting the wrist, wearing a brace to keep it straight, and maybe steroid injections to calm down inflammation. It's only if those things don't solve the problem that surgery becomes an option, which is designed to physically create more room for that nerve.
All right, we've gone from symptoms to the anatomy to treatment. So let's just boil this all down. What is the one big takeaway here?
If you remember one thing, make it this: that pins and needles feeling isn't something you should just ignore or shake off every morning. It's a direct signal. It's a nerve literally crying out for help. And just by understanding what we talked about today, what's causing it, and knowing there's a clear path to fix it, you've already taken the most important first step toward relief.